The following is a hypothetical case. Mindy was born in San Antonio. As a toddler, her father, a pulmonologist, wanted to teach her to swim at a young age, so he immersed her into their family pool. She held her breath well and kept her eyes wide open. At 5, her dad thought she had superior lung capacity and tested her using spirometry. She tested at the 95th percentile for her age. It stood to reason that Mindy chose swimming as a sport. When she turned 18, she started to experience fatigue and sleeplessness. She suffered ocular problems including pain, swollen eyelids, and sensitivity to light. Her clinician performed a physical exam and ordered routine lab tests, but Mindy was very afraid of needles. As a child, she had a bad reaction to a vaccine that she had been given. Mindy conducted an internet search to find a blood testing alternative. She located a company that offered a standardized method of collecting blood from a finger stick and asked her doctor to order it for her. Unlike other failed companies before them, this one had peer-reviewed documentation of their performance. Betterway blood testing uses a simple finger stick instead of the traditional needle in the arm. The patient's hand is warmed during collection. The patient doesn't see the lancet and doesn't know when the stick occurs until after it happens. Once the blood is collected, sample processing is automated by a patented machine, and then the sample is sent to a high-throughput laboratory. Most importantly to Mindy's doctor and father, the results are medically accurate and equivalent to traditional methods. Mindy had her collection done at a local pharmacy. It was a much better experience. All of Mindy's tests were normal except for a low thyroid stimulating hormone or TSH level. After further tests, the doctor made a final diagnosis of primary hyperthyroidism or Graves' disease. Mindy became depressed at learning about her illness. She stopped swimming and her grades began to decline. Then her father told her about a couple who both had this disease and continued to achieve greatness. She read up more about this well-known couple's medical journey. It worked. Mindy resumed the pursuit of her dreams. A repeat blood test months later revealed a near-normal TSH result and she was in remission. Mindy resumed her swimming and earned an athletic college scholarship. She did not let her chronic disease get in the way of achieving her goals, and new blood collection devices facilitated this. This illustrates why blood testing is so important. The incidence of Graves' disease in the US is 1 to 2%. The TSH test is key in making the diagnosis. With treatment, patients can resume normal productive lives. First Lady Barbara Bush was diagnosed with Graves' disease in 1989. Coincidentally, President George H.W. Bush was diagnosed 2 years later while in office. Their disease did not affect their ability to lead the nation. Stay tuned for more lab tales.